Hey everyone, I'm Dr. Justin Scott. I'm a general dentist right here in the beautiful city of Atlanta. And in this video, I'm going to be sharing with you some of the deepest insights I can possibly give you as a dental professional. I'll be sharing with you the top 5 questions that you should ask a dental implant provider before committing to surgery. This will help you determine the credibility of your doctor on a deep level in a very short amount of time. Question number 1. What is the provider's formal education in dental implantology? Who are they trained by, and what form of training did they receive? How long did it take them to go through the training? These are all questions related to the dentist's professional schooling on implants, and they're really important. For example, I've gone to multiple CE courses where I studied under board-certified surgeons on how to place dental implants. This means that I've devoted hundreds of hours of taking notes, learning every possible complication that can occur, and then I had to pass numerous exams that were proctored by other implantologists who were overseeing my apprenticeship in these programs. So as a person looking for an implant, make sure to ask for the dentist's formal education background. And if they don't have an extensive amount of formal training, I would even go as far as asking for a guarantee on the implants. You have to make sure that the person who is placing your dental implants is credible. Question number 2. Does the dentist have a 3D CT scan? So this is something that most patients don't understand. There's a significant difference between traditional x-rays and a 3D CT scan. An x-ray is the two-dimensional image showing you the layout of the bone structure. In the case of placing implants, an x-ray will give us an idea of how close your tooth roots are, how thick your jawbone is, and other important territorial details that would allow us to place the implants safely. However, x-rays still leave marginal room for error. It's up to the dentist's interpretation and usage of the x-ray to make sure to place the dental implants safely. A 3D scan dramatically limits the risk. A 3D CT scan allows us to get a complete 3D map of your bone structure so that you can plan every step of the surgery beforehand. It allows us to create 3D surgically printed guides so that the implant can be placed into the jawbone at the most precise angles and depth possible. In short, a 3D CT scan reduces the risk of errors by a large margin. If you're looking to get implants, make sure to go to a dentist that has one on hand. We have a 3D CT scan at our office and we use it every day. I personally wouldn't want to place a dental implant without having one. Question number 3. Will the dental implant and crown be placed in the same office? So in many general dentist offices, they'll separate the dental implant processes among 2 different dentists. One dentist will be the actual surgeon who places the dental implant. The other dentist will be the one who's responsible for placing the crown on top of the implant. There's nothing wrong with this approach as long as the dentists are working closely together on this approach. I've seen some weird cases in the past where one doctor placed the implant and the patient went to an entirely different office to have the crown placed. The end result was a weird looking dental crown. The patient didn't like the way the crowns looked because the doctors failed to collaborate effectively. So I would recommend working with an implant provider who works closely with the dentist who's placing the crown. Make sure the whole process is under the same roof. This will decrease the margin of error and increase the likelihood that the final crown looks perfect. Question number 4. The success of your implant surgery depends largely on how your dental implant surgeon takes into account your medical history. For example, people who have diabetes will have a much harder time healing from the dental implants, so they will require extra steps to ensure that they have a successful end result. they need to go see their doctor prior to coming in to make sure everything's healthy enough to have the procedure. Question number 5. How accessible will your surgeon be after the dental procedure? This is an absolute must. The fact of the matter is that there's a small chance that something unexpected could happen after your surgery. The implant provider may have done everything perfectly to a T, but for some reason your stitch comes out a week later. And now you're freaking out because you think that your implants might fall out of your mouth or get infected. What do? Can you call your surgeon and get it taken care of? You should have your surgeon's word that they'll prioritize you if something wrong occurs. And I just want to add a little side note here. This is one of the reasons why I get really concerned when I hear about people going and getting implants in another country. If you get an implant in, say, Mexico or India, and then you come back a couple of days later and something goes wrong, then you've got to go back to get it fixed. It's a real problem. Anyway, that concludes all of our content. Those are the top 5 most important questions that you should ask prior to getting surgery. I hope this gives you insight on the variables you should consider as a potential dental implant patient. If you found value in this, go ahead and give this video a thumbs up and share it with your friends. Until next time, this has been Dr. Scott with Pure Dental Health in Atlanta, Georgia.